So welcome, thank you for coming during your clinical day or during your prep day to see this presentation today. So for those of you who don't know me, I'm Tanya. I teach on 5000, and when I did my master's degree a long time ago, my focus was on sepsis. And on our ward on 5000, we've seen, I have to sit down so I get on the video. So we've seen a lot of patients with sepsis over this term. And I know in the 332 class, you have been talking about shock, or you will be in this last week, in the concepts of critical care. So a few months ago, I was on Facebook, which I probably am too many times in a day, and I came across this story from the Canadian Patient Safety Institute. And as I'm looking at the picture of the patient, I'm like, this looks really familiar to me. A comment my 6-year-old son says all the time. But it was the city hospital background and a patient lying in a bed. And I got reading the story, and this is Lanny and her mom Helena. And the story was about Lanny in ICU, in my ICU at City Hospital about 10 years ago, and her story about sepsis and her experience with sepsis. And basically the Canadian Patient Safety Institute was trying to tell us that something we've been teaching you in the classes, and that early recognition of sepsis is key in preventing long-term complications. Now, we came up with this concept roughly within the last 10 years, so kind of after Lanny's experience. So today, she is here to talk about her experience with sepsis. Now, sepsis is one entity of her whole situation. So she had sepsis 10 years ago. You'd think she should be good now, right? But when I did my master's degree, my work was all looking at quality of life in sepsis survivors. And today is going to give you an inside look at what this disease, so this essential lack of oxygen to her tissues, did to her and how that's affected her now 10 years later. Some other things that you're going to hear from Lanny in her story is not just about her experience in ICU and having sepsis and suffering afterwards, but Lanny, before she had sepsis, has a chronic disease. She has chronic pancreatitis. Okay, so those of you who are on surgery know, oh yeah, I know all about pancreatitis. I've seen a lot of that. But she's chronic genetic pancreatitis. So she had it when she was younger, and this was discovered later on as her children were diagnosed with the disease. And that put into perspective, oh, this is what this pain is that I've had all along. So because of that, you know with pancreatitis that patients can have a lot of pain. So throughout her life, she's had a lot of chronic pain. Now, what do you see in the hospital in patients who have chronic pain and then have an acute situation that happen on top of that? How are they treated, do you see, in hospital situations? Right? In Lanny's experience, when she came in with her sepsis, she was saying, I'm having lots of pain. But they labeled her as drug-seeking because she had this chronic record of having lots of pain. So the tolerance that she had developed for pain control, you know, the little pain meds that they gave her, never really affected her pain. So when she came in saying, there's something wrong with me, they just labeled her and sent her home. So she didn't come back into the hospital until her sepsis was full-blown. Okay, so I want you to take a few things out of this presentation. And one is really to apply the concepts of sepsis and shock and how that lack of perfusion has now affected her life on the long-term spectrum, how an acute illness can have effects to be similar than a chronic disease, how the effects of that chronic disease affects now the rest of her life, but also all the events that happened to her during this stay. I want you to consider, because I know you guys are really strong patient advocates, right? So I want you to take that information and use it every time you see a patient coming in with a concern, right? To individualize them and to treat them all with respect and to value their opinions so that we don't make errors in healthcare, and so that we treat these illnesses and prevent them before they get too serious. So before we start, does anybody have any questions? Okay, I'm going to switch over here then. Who's talking first?
Talk first. I don't care. Doesn't matter.
We'll just turn them both on and then you...
Mine are both on. Okay. I guess I've also had a bleeding disorder too for my whole life, and had really heavy periods, and that was why I had the ablation done, was because I was done having my children, my tubes were tied, and I didn't want to bleed anymore. It was just a lot of pain, and a lot of pain actually. So I went in for the surgery and they said that there wasn't going to really be much pain afterwards, minus like menstrual cramps. Well, I've had horrible menstrual cramps since I was 13 years old, like to the point where I couldn't get out of bed. So I thought, well, can't be that bad. And when I woke up, it was a lot worse than that. And I told them on the floor that it was worse and that there was something wrong. And they didn't listen. And they didn't call the doctor. And they sent me home. So I thought, well, maybe that's normal, you know. I went home for probably, I don't know, maybe 8 hours. I came back to emerge. I couldn't urinate. I couldn't even really walk. Like, I was hunched over in so much pain. And again, the doctor did nothing. He didn't ask really anything. I told him I just had a surgery, like there's something wrong. You know, I had had other surgeries, there's something wrong, I know there is. And he said no, even none of the nurses, like nobody said anything. The only lady that I can remember was one of the healthcare people that come and stock stuff or put towels and whatever it is into the rooms. And I remember she looked at me and she said, "Are you okay?" And I said, "No, I'm not okay." And she just looked at me like as I was as sick as I was, and that was the only person, nobody else. Now, still to this day, there's no nurse's notes on the night that I was there that I had gone. And he labeled me drug seeking and sent me home, and he gave me pills that would make me urinate. So I went home and laid in my bed, and it was probably 24 hours, and I vomited like buckets. Like, my garbage was probably this big, and like buckets and buckets and buckets of bowel contents for the next 24 hours. And my partner at the time, again, I mean, we didn't know. We just didn't know what was wrong. So I remember he went out to the living room and was watching soccer, and I said, like, I have to go back to the hospital. And I phoned the ambulance, and because I couldn't move, like, I was just dying, and they came and picked me up, and I had no blood pressure in the ambulance. And when I got to emerge, they listened because they didn't have any choice but to. And all that I really remember is the doctor coming in, and he was in his golf outfit, and he said that I might have a colostomy bag when I was done the surgery. And from then, I don't remember anything until probably a week later. And I've just never been the same. I thought, I had had a surgery the year before. They took my gallbladder out. They thought it was to do with my pancreas, and I bounced back from it. I was in the hospital for 6 weeks. I have pancreatitis, and I bounced back from it. I was doing laundry. I have 2 kids that are now 17 and 13, but I could care for them. And I remember getting out of ICU, and I mean, still to this day, just even showering is like the biggest task ever. Like, just doing anything, it's just really, really difficult. I have severe pain throughout my whole body. I feel like I said, I don't know, the best way that I've ever described it is that I feel like I have the worst flu, plus all your muscles are pulled times like a million, like the sickest, excuse me, that you've ever been times a million. I am nauseous all the time. I throw up all the time. My muscles are, like, my body is ruined, like completely ruined. I can't do anything. I've exercised throughout the years because so many doctors will say, no, it's not that, it's because you're laying in bed or this and that. Well, I've raised my kids, like I didn't have a choice. This is 10 years ago, so they were 3 and 7 at the time. I've raised my kids, I've watched other people's kids, I've tried to live. Yet you don't have a choice. Like, I didn't have anybody else to do it for me. So it's just, and now it's gotten worse. My muscles are just wrecked. Like, I don't know, I can't physically do anything. Now I have a torn rotator cuff. It feels like my other one is torn just from doing anything. Like, I was cleaning and I lifted a big bucket, and that's how I tore it. And people, again, they don't believe me. It's like, well, you shouldn't be like that. And I say, well, from the day that I can remember going septic or waking up from being septic, this is how I felt. I can't wear a bra. I can't, to wear it. I can wear it, but it feels like just pain. It feels like it's like knives stabbing into me. Or to wear tight jeans, it feels like just pain everywhere. And my lungs, the bottoms of my lungs were collapsed, and I can't breathe properly, which has been, again, the whole time. And